If you're over 60 and you've been feeling tired, forgetful, weak, or simply not like yourself lately, what I'm about to show you in the next few minutes could explain everything. Because here's what almost nobody tells you. There is one hidden process happening inside your body right now that can perfectly mimic the symptoms of aging. It can look like memory loss. It can feel like depression. It can cause your muscles to cramp, your heart to flutter, your balance to fail, and your energy to disappear completely. And your doctor may have looked you right in the eye and told you everything is fine. It's not a disease. It's not a tumor. It's not even something that shows up on most standard blood tests. It's nutrient deficiency. And it is silently affecting tens of millions of Americans over the age of 50 right now, including, possibly, you. I've spent over 2 decades watching this happen to patients. Smart, careful people who eat well, take their medications, and do everything right. And they still end up feeling like their body is falling apart because nobody checked the one thing that could explain all of it. Today, I'm going to change that for you. I'm going to show you 23 specific warning signs your body may be sending you right now. Some of them will surprise you. A few may stop you cold. And by the end of this video, you'll know exactly what to do. Stay with me, because sign number 7 is the one that concerns me most. And sign number 15 is the one that almost every senior over 65 is getting completely wrong. I'm Dr. William, and for more than 20 years, I've worked with patients in their 50s, 60s, 70s, and beyond. I've seen firsthand what nutrient deficiency does to a human body over time. And more importantly, I've seen what happens when we finally catch it and fix it. I used to see patients who had already been to 3, 4, sometimes 5 other doctors. They'd had their standard labs done. Everything came back normal. But they were exhausted, confused, in pain, slowly losing pieces of themselves. When I started looking deeper, beyond the standard panels, into actual cellular nutrient status, the answers were almost always right there. And the recoveries I witnessed were remarkable. That's what today is about. Not alarm, not fear, knowledge, and a clear path forward. Let's begin. Before we go through the 23 signs, I need you to understand one crucial thing. After age 50, your body doesn't absorb nutrients the same way it did when you were younger. The stomach produces less hydrochloric acid, the acid that breaks down food and extracts minerals like iron, calcium, zinc, and B12. Less acid means less absorption. You can eat perfectly and still be running on empty. The kidneys become less efficient at activating vitamin D. The intestines absorb calcium and magnesium less effectively. And if you're taking a proton pump inhibitor for heartburn, a statin for cholesterol, a diuretic for blood pressure, or metformin for blood sugar, there's a very real chance your medication is draining key nutrients from your body every single day without you knowing it. Think of your body as a car engine. The food is the fuel. But after 50, the fuel filter starts to clog. You can keep filling the tank. But if the filter isn't working, the engine starves. And a starving engine starts to break down in very specific ways. Here are the 23 ways your body may be telling you that right now. The first sign is persistent fatigue that sleep doesn't fix. I can't tell you how many patients have sat across from me and said, "Dr. William, I slept 8 hours and I still feel like I haven't slept at all." That kind of bone-deep, chronic tiredness that doesn't improve with rest is one of the most common signals of low iron, B12, or folate. These nutrients work together to help your body produce healthy red blood cells. Without them, your organs and muscles are starved of oxygen. The result is exhaustion that no amount of sleep can fix. The second sign is muscle cramps and leg cramps at night. If you've ever been jolted awake by a painful cramp in your calf or foot, your body may be running low on magnesium, potassium, or calcium. These electrolytes are essential for proper muscle contraction and relaxation. When levels drop, the muscles lock up in a painful spasm. Magnesium deficiency in particular is extremely common in older adults, especially those taking diuretics or blood pressure medications. The third sign is brain fog and difficulty concentrating. When patients tell me their thinking feels cloudy, that they walk into a room and forget why, or words don't come as easily, these can be signs of low B12, omega-3 fatty acids, or vitamin D. B12 maintains the myelin sheath, the protective coating around your nerves. Without enough of it, nerve signals slow down. That includes every signal involved in thinking, remembering, and focusing. Now, those first three signs are serious. But here's where things get darker and far more urgent. Because the next warning sign is one that millions of seniors dismiss every single day. And by the time they stop dismissing it, real damage may already be done. The fourth sign is tingling or numbness in your hands and feet. That pins and needles sensation in your fingers or toes is not just poor circulation. In many cases, it is a direct warning sign of B12 deficiency causing early nerve damage. I've had patients come in after months of ignoring this symptom, and by the time we caught it, their B12 levels were critically low. Peripheral neuropathy, nerve damage in the extremities, can become permanent if left untreated. If you are experiencing this right now, please do not wait. Talk to your doctor about checking your B12 levels this week. The fifth sign is brittle nails. Nails that break easily, peel in layers, or have vertical ridges are often a sign of low biotin, iron, or calcium. In healthy adults, nails should be smooth, firm, and consistently pink. When they change in texture or strength, it's your body flagging a shortage of something essential. The sixth sign is hair thinning or excessive hair loss. Hair loss is often blamed on genetics alone. But I've seen significant thinning reverse in patients once we address deficiencies in iron, zinc, biotin, vitamin D, and protein. The hair follicle is one of the most nutrient-hungry structures in the entire body. When nutrients are scarce, the body rations them, protecting the heart and brain first, and leaving the hair follicles with whatever remains. The seventh sign is poor wound healing, and this is the one that concerns me most. If a cut or scrape takes much longer to heal than it used to, your vitamin C and zinc levels may be dangerously low. Vitamin C builds collagen, the structural protein that holds your skin, blood vessels, and connective tissue together. Zinc powers immune response and cell repair. Without both, even a minor wound becomes a prolonged healing problem. In patients with diabetes, this can escalate into something far more serious, and far too quickly. If you've noticed your skin healing slowly, please bring this up with your doctor at your next visit. Don't assume it's normal. Most people think the signs we've covered so far are the most dangerous ones. But what I'm about to share next surprises almost every patient I tell it to. Because these next warning signs don't look like nutrition problems at all. They look like something else entirely. And that's exactly why they get missed. The eighth sign is bone pain or frequent fractures. Most people know calcium is important for bones. What they don't know is this. Without adequate vitamin D and vitamin K2, the calcium you consume doesn't end up in your bones. It ends up in your arteries and soft tissues instead. I've seen patients taking calcium supplements faithfully for years while their vitamin D remained critically low and their bones kept weakening. Bone pain in the hips and lower back, and a history of stress fractures are all red flags worth discussing with your doctor urgently. The ninth sign is frequent infections or getting sick often. Your immune system is entirely dependent on nutrients to function. Vitamin C, vitamin D, zinc, and selenium are all essential for immune defense. If you catch every cold that passes through, take a long time to recover, or deal with recurring infections, your immune system may simply not have the raw materials it needs to protect you. The 10th sign is depression, anxiety, or low mood. This one surprises people most. But the connection between nutrient status and mental health is not subtle. It is direct and well documented. Low vitamin D, low omega-3s, low magnesium, low B12, and low folate have all been strongly linked to depression and anxiety. Your brain needs these nutrients to produce serotonin and dopamine. Without them, even someone with a positive personality and good life circumstances can find themselves feeling inexplicably hopeless, irritable, or flat. If you or someone you love has been struggling emotionally without a clear reason, a comprehensive nutrient panel may reveal something that no one has thought to look for. I want to stop here and tell you about Walter. Walter was 68 years old when he first came to see me. Retired schoolteacher from Ohio. Sharp, funny, deeply frustrated. He'd already seen 3 other doctors over the past year. Every single one told him he was fine. But Walter knew he wasn't fine. He was sleeping 9 hours and waking up exhausted. His leg cramps were so severe his wife had moved to the guest room. He was forgetting names of students he'd taught for 30 years. His feet tingled constantly. He'd started feeling depressed in a way he couldn't explain. and that scared him most. One specialist suggested early Parkinson's, another offered anxiety medication. When Walter came to me, the first thing I did was run a comprehensive nutrient panel. The results arrived within a week. B12 was at 187. Optimal is above 500. Vitamin D was at 19. We want to see 50 to 70. Magnesium was low. Omega-3 fatty acids were borderline deficient. Walter wasn't aging badly. His body had been running on near empty for years, and not a single prior doctor had thought to check. Within 3 months of addressing those deficiencies, working carefully with his primary care physician, Walter called me. He said simply, "Dr. William, I feel like myself again for the first time in 2 years." I've heard those words more times than I can count, and I share Walter's story because you may be living it right now. Walter's story is powerful. But here's what made his case truly alarming to me. The most dangerous deficiency he had wasn't the one causing his most dramatic symptoms. It was a quieter one that almost never gets caught. And I'll show you exactly what that is in just a moment. First, signs 11 through 16. These are the ones most seniors never connect to nutrition at all. The 11th sign is dry skin, eczema, or persistent rashes. The skin barrier depends on essential fatty acids, vitamin A, vitamin E, and zinc to stay intact. When these nutrients drop, moisture escapes, inflammation sets in, and no topical cream fully resolves it, because the problem is internal. If your skin has become persistently dry, sensitive, or inflamed despite using moisturizer regularly, look inward before you look to the pharmacy shelf. The 12th sign is swollen or bleeding gums. Persistently swollen, sensitive, or bleeding gums can be a direct sign of vitamin C deficiency. Full scurvy is rare today, but subclinical vitamin C deficiency, low enough to cause chronic gum inflammation without presenting as an obvious disease, is far more common than most people realize, especially in older adults who eat limited fresh fruits and vegetables. The 13th sign is restless leg syndrome. That crawling, urgent need to move your legs at night is associated with low iron, specifically in the brain, not just low blood iron generally. If you've been relying on medication to get through the night, ask your doctor to check your serum ferritin, your iron storage level, along with your full iron panel. The underlying cause may be addressable. The 14th sign is a sore or swollen tongue. A tongue that appears unusually red, smooth, or swollen, or that feels persistently sore, is often a sign of B vitamin deficiency, particularly B2, B3, B6, or B12. In severe B12 deficiency, the tongue surface begins to atrophy. This symptom is easy to overlook but should never be dismissed. The 15th sign is unexplained weight gain and a slowing metabolism. And this is the one most seniors over 65 are getting completely wrong. Most people blame a slowing metabolism entirely on age. And yes, metabolism slows naturally. But an underperforming thyroid, driven in part by low iodine, selenium, and zinc, can accelerate that slowdown dramatically. Unexplained weight gain, persistent cold intolerance, constipation, and fatigue that looks identical to depression can all trace back to a nutrient-starved thyroid. Yet thyroid nutrient support is almost never discussed at routine appointments. If your weight has been creeping up despite no real change in diet or activity, please ask your doctor about a full thyroid panel and nutrient screen together. The 16th sign is worsening night vision. Do you find it harder to see in dim light than you used to? This can be a direct sign of vitamin A deficiency. Vitamin A produces rhodopsin, the pigment your eyes use to see in low light. In more advanced deficiency, it leads to dry eyes and can contribute to permanent vision damage. Vitamin A is found in liver, eggs, dairy, and deeply colored vegetables like sweet potatoes and carrots. If your night vision has noticeably declined, bring it up with your doctor. Here's what I want you to understand as we go deeper into this list. These aren't rare, exotic conditions. Every single sign I've described today I've seen in ordinary, otherwise healthy people. People who were doing their best, eating reasonably well, taking their medications. They just didn't know what their body was trying to tell them. And what's coming next? Signs 17 through 23. These are the ones with the most serious long-term consequences if they go unaddressed. The 17th sign is high blood pressure that's hard to control. Most people with hypertension focus entirely on reducing sodium. And yes, sodium matters. But magnesium and potassium play equally critical roles in blood pressure regulation. Magnesium relaxes the walls of blood vessels. Potassium helps the kidneys clear excess sodium from the body. Research consistently shows that people with adequate levels of both have significantly lower blood pressure. If your numbers are difficult to control, even with medication, talk to your doctor about checking these two minerals before adjusting your prescription. The 18th sign is dizziness or poor balance. Unexplained dizziness and balance problems can be driven by B12 deficiency, because the nervous system, which coordinates balance, depends on B12 for healthy function. Low iron, which reduces oxygen delivery to the brain, can also cause lightheadedness when standing up quickly. In older adults, this significantly increases fall risk. Falls are one of the leading causes of serious injury and hospitalization in seniors. If you've been dizzy or unsteady, please don't chalk it up to aging alone. The 19th sign is heart palpitations or an irregular heartbeat. Low potassium and low magnesium can both trigger palpitations and irregular heartbeats. If you felt your heart flutter, skip a beat, or race without obvious cause, and your cardiologist has found no structural explanation, please ask about your electrolyte levels. This is especially critical for anyone taking diuretics, which are well known to deplete both potassium and magnesium steadily over time. The 20th sign is chronic constipation. The gut depends on magnesium, B vitamins, and adequate fiber to move properly. Magnesium draws water into the colon and stimulates the muscular contractions that push food through. Magnesium glycinate or magnesium citrate can support healthy bowel function while simultaneously addressing the underlying deficiency. If you've been struggling with constipation for years and treating it only with laxatives, you may be missing the root cause entirely. The 21st sign is always feeling cold. If you're perpetually colder than everyone around you, hands and feet icy even in a warm room, this can signal low iron, low B12 affecting circulation and nerve function, or a thyroid underperforming due to low iodine or selenium. Cold intolerance is routinely dismissed as just how you are. In many cases, it's your body asking for something specific. The 22nd sign is memory lapses and cognitive slowing. Not every memory problem is the beginning of Alzheimer's. I want to be careful and clear here. But B12, folate, omega-3 fatty acids, and vitamin D all play direct, documented roles in protecting brain cells, supporting memory, and reducing neuroinflammation. Research has linked chronically low B12 and omega-3 levels to accelerated brain aging. Addressing nutritional deficiencies won't reverse existing damage, but it may meaningfully protect the brain function you still have. And that protection matters enormously. The 23rd sign is a persistent feeling that something is simply off. Some patients come to me and say, "I don't feel like myself anymore." They're not pointing to one symptom. They just feel less. Less energy, less clarity, less joy, less resilience. Everything is harder than it should be. Everything requires more effort than it used to. That experience, vague, persistent, unexplainable, is something I take seriously. Because in patient after patient, a thorough nutrient evaluation reveals a body that has been running on a deficit for so long that feeling unwell has quietly become the new normal. It doesn't have to be. That is not aging. That is depletion. And depletion is fixable. Let me tell you about Donna. Donna was 71 when her daughter brought her in to see me. She'd stopped doing the things she loved. No more gardening. Fewer calls to her grandchildren. She seemed distant, moving through her days slowly, like something had dimmed inside her. Her family was starting to have quiet, frightening conversations about what might be wrong. Her last annual physical showed nothing out of the ordinary. Standard labs, all within normal range. When I ran a comprehensive nutrient assessment, I found vitamin D at 14, critically low, less than a third of where it should be. Omega-3 fatty acids low, B12 borderline, magnesium at the absolute bottom of the reference range. Donna's brain and body were operating under profound nutritional stress. Of course she had checked out. She was running on fumes. Working closely with her physician, we built a plan. Optimizing vitamin D through supplementation and careful sun exposure. Sublingual B12, the kind that absorbs under the tongue, bypassing the gut absorption issues that come with age. Omega-3 rich foods and a quality fish oil. Magnesium glycinate before bed. 4 months later, Donna came back for her follow-up. Her daughter came with her. Her daughter said, "Dr. William, I have my mother back. I've heard that sentence more times than I can count, and every single time, it reminds me why this work matters. Now, I want to talk about the 4 mistakes I see most often, because good intentions can work against you if you're making these. The first mistake is relying only on standard lab results to tell the full story. Routine blood panels don't check for most nutrient deficiencies. A standard metabolic panel checks kidney function, blood sugar, and basic electrolytes. But it won't tell you your B12, your vitamin D, your intracellular magnesium, your omega-3 index, or your zinc. You have to ask. Most doctors won't order these unless prompted, so prompt them. The second mistake is assuming that eating well is enough. After 50, absorption is the real issue, not intake. Even an excellent diet can fall short when the gut isn't absorbing efficiently. B12 from food requires a substance called intrinsic factor to be absorbed, and intrinsic factor production declines significantly with age. You can eat all the salmon and leafy greens you want. If your gut isn't extracting the nutrients, they pass through. The third mistake is taking the wrong form of a supplement. Magnesium oxide, one of the cheapest, most widely available forms, is poorly absorbed and mostly acts as a laxative. Magnesium glycinate and magnesium malate absorb far better. Vitamin D3 outperforms D2. Methylcobalamin or hydroxycobalamin B12 is more bioavailable than cyanocobalamin, particularly for seniors with absorption challenges. The form you take matters as much as the dose. The fourth mistake is ignoring drug-nutrient interactions. This is perhaps the most underappreciated mistake of all. Metformin, one of the world's most prescribed diabetes medications, depletes B12. Proton pump inhibitors deplete B12, magnesium, and calcium. Statins deplete CoQ10, an enzyme critical for heart muscle and energy production. Diuretics deplete potassium and magnesium continuously. If you are on any of these medications, please ask your doctor or pharmacist today whether you need to be monitoring or supplementing these specific nutrients. Here is exactly what I recommend you do this week. First, request a comprehensive nutrient panel. Ask your doctor specifically for vitamin D, vitamin B12, folate, serum ferritin, complete iron panel, RBC magnesium, and zinc. These tests exist. They are available. You just have to ask for them. Second, sit down with your pharmacist and ask one specific question. Does any of my current medication deplete vitamins or minerals? And if so, what should I be monitoring? A knowledgeable pharmacist will know exactly what to look for. Third, build nutrient density into every meal. Dark leafy greens for magnesium and folate. Fatty fish like salmon and sardines for omega-3s and vitamin D. Eggs for B vitamins. Nuts and seeds for zinc, selenium, and magnesium. Fourth, if deficiencies are confirmed, work with your doctor on a targeted supplementation plan. Do not self-prescribe high doses without guidance. The goal is precision, not excess. Fifth, get safe, regular sunlight. 15 to 20 minutes of direct exposure on the arms and legs, 3 to 4 times per week, can meaningfully support vitamin D production. It costs nothing, and it works. Drop a comment below and tell me, how many of these 23 signs have you been experiencing? Were any of them surprises? And if you're comfortable, tell me your age and where in the country you're watching from. I read every single comment, and your experience may be exactly what helps someone else finally recognize what's been happening to them. Here is what 20 years of working with patients over 50 has taught me. The human body is extraordinarily resilient. Even when it has been running on a nutritional deficit for years, it retains a remarkable capacity to recover once it receives what it's been missing. Walter recovered. Donna recovered. I have watched this happen dozens of times. Not through miracle interventions, but through something far simpler. Giving the body the raw materials it needs to do what it already knows how to do. But it can only work with what you give it. It cannot build strong bones without vitamin D and K2. It cannot protect your brain without omega-3s and B12. It cannot regulate your heart without magnesium and potassium. It cannot heal your skin and tissue without vitamin C and zinc. It cannot run a healthy immune defense without selenium and vitamin D. You are not simply a passenger in your own aging process. You are an active participant. The choices you make this week about what you eat, what questions you ask your doctor, how you think about your body's signals, those choices carry real, lasting consequences. So do not dismiss these 23 signs. Do not write them off as normal aging. Advocate for yourself. Ask for the right tests. Find a provider who takes your symptoms seriously, because your body has been sending you messages, and now you know how to read them. Now, before you go, I need to tell you something that surprised even me when I first discovered it. We've spent today talking about what your body is missing, but there's an equally important and almost completely overlooked side to this story. The everyday habits that are actively destroying whatever nutrients you do have. Habits so common, so routine, so completely ordinary that most people do them without a second thought, every single morning. In my next video, I go through the 7 daily habits that are silently draining your nutrients, inflaming your gut lining, and accelerating the aging process from the inside out. One of them involves something almost every American over 60 does within the first 30 minutes of waking up. When I show it to patients, the reaction is always the same: shock, then recognition, then, finally, relief that they now know. Everything in that video connects directly to what we've covered today. The 2 videos together give you a complete picture: what you're missing and what's stealing it from you. The link is on your screen right now. Click it, and I'll see you there. I'm Dr. William. Take very good care of yourself. You deserve nothing less.